Indiana University Law School in Indianapolis. I am a public health attorney, and my practice and research is at the intersection of federal Indian law and health law. I am non-native, and it's important that I share that. As a non-native researcher, I can perpetuate a lot of harms unintentionally, although I hope to be an ally and advocate in the work that I'm doing. And I'm going to be talking about legal epi and tribes. I was in practice before becoming a professor at the Centers for Disease Control and Prevention. And most of my work there was working with brilliant public health practitioners like y'all and putting together legal epidemiology studies. And so what I want to do in the about 45 minutes that we've got is give a little bit of introduction on the lay of the land in terms of tribal public health authority and federal Indian law. I'm going to go through that material really fast because you all can school me on that front. And then we're going to talk about what exactly legal epidemiology is and a little bit about my work about translating if and how legal epidemiology research into Indian country. So since I have a ton of slides and I talk way more than I should, I'm going to go ahead and get rolling. Want to acknowledge that the whole point of legal epidemiology is to scientifically study the health outcomes when law and policy are being implemented. And in the context of tribes and tribal sovereignty, tribes have an inherent public health authority. That authority predates the United States. Tribes have been exercising that jurisdiction over their lands and peoples since time immemorial. Because of federal Indian law, the legal framework that defines the rights, relationships, and responsibilities between tribes, states, and the federal government, it makes teasing out which law and how law impacts Indigenous communities far, far more complicated, because as a product of colonization and genocide, the federal government, although has agreed to recognize tribal sovereignty and their inherent public health authority, they do that with what I like to call strings attached. They've put conditions on the exercise of tribal jurisdiction. And so while tribes exercise their governing authority through a variety of legal mechanisms, through procedures and practice and governance, and through cultural teachings and practices that they might incorporate in documents or just into the day-to-day governing decisions. We see a lot of variability of tribal exercise of their public health authority through legal interventions. So while some tribes will have specific references to health and safety as part of the powers of tribal governments, that is not universal by any means. And of course, not every tribe has a constitution. Some tribes will have really explicit public health codes or have a designated public health office or a health department that has functions that are expressly listed in their code language related to public health activities, but it's going to be really variable and depend on the tribe. One thing that is relatively common in reviewing the tribal public health tribal codes that I have had access to is that public health powers can be decentralized across multiple agencies. And so you might have a social services department or agency with a tribe or an environmental protection department, all engage in certain functions that we would very easily categorize as public health. We have, of course, on top of this layer of federal responsibilities to provide healthcare, federal treaty and trust responsibility to support tribes as sovereigns and to support tribes as self-governors. the exercise of this requirement through the ITU system. And what we've seen is in the context of evidence related to the efficacy of laws like Public Law 638, the law, Indian Self-Determination and Education Assistance Act, that established the self-governing programs that facilitated Tribal 638 programs. A real lack of scientific evidence, peer-reviewed evidence, again, Western evidence, in the efficacy of these programs. And so I want to highlight this one particular study that I'm going to talk about more, because this is one of the first times that I have seen a researcher attempt to study, to conduct a legal epidemiology study in the context of Tribal 638 programs. And I'm going to loop back to that here in a few minutes after we talk more about legal epidemiology. So I wanted you all to have, wanted us all to be on the same page of the fact that we've got federal laws that are going to impact public health outcomes in Indian country, that we're going to have tribal laws that are going to impact public health outcomes, and we're going to have state laws that are going to impact public health outcomes, that at the tribal level, we're going to see a lot of variability in what public health laws are going to be on the books and what those programs look like. And so when we look at a scientific study like legal epidemiology, it's trying to quantify law in a way to establish whether that law is supporting, harming, or making no difference to a health outcome. So our technical definition of legal epidemiology is bringing the scientific rigor that we expect from other science and from other sciences to the study of law. And in practice, that means that you're comparing legal data with health outcome data. Now, I am a lawyer. I am not a data manager. I am not a statistician. I'm not an epidemiologist. But my skill set as a lawyer means that I have the tools to research, collect, and analyze laws. And part of legal epidemiology is figuring out a way to translate those very dense, very boring, and frankly, very poorly written documents a lot of the time into ones and zeros so that I can pass it on to my brilliant statistician and epi and data manager colleagues so that they could actually conduct the statistical analyses, the regression analysis, to actually say what impact the law is going to have. And so when you see maps, whether it's a map like on my left with different colors across different states, or a polar graph that's on my right, where it's trying to categorize 7 different variables in terms of vaccination laws across states, the first step for legal epidemiology studies is to see what laws are on the books. And then the next step will be coupling it with health data. Before legal epidemiology studies developed, when lawyers were involved in this kind of research, they relied a lot on vibes. So you would never expect a social science researcher to just pull up their database and do a few searches to find some relevant laws and not tell you, and then just hand it to someone and be, here's the laws in the books, right? This scientific method requires that you have dates, that you document search strings, that you produce enough of a data trail so that it can be reproducible. And so legal epidemiology has tried to add the same scientific rigor that you would expect in any kind of study, whether it's qualitative, quantitative, clinical, to create then a rigorous enough legal data set that you could actually hand it over to the math people to be able to conduct analyses in terms of impact. So I want to give a couple of examples of legal epi studies one that I was involved in when I was at CDC, Association of State Laws with Influenza Vaccination of Hospital Personnel. I was involved, one of two attorneys on a team, and we looked through every state's laws related to healthcare worker vaccination requirements for flu in the hospital setting, and determined whether that state required the hospital to assess their employees for whether they've had the influenza vaccine, whether the hospital the state law required the hospital to offer the vaccine, whether the state law required hospitals to ensure vaccination, or as the final category we're looking at for those employees that were not vaccinated for flu, whether they were required to wear a surgical mask. So we took the laws and turned them into ones and zeros across these four categories. And then we passed that information on to our colleagues who went and assessed how many healthcare workers were actually vaccinated for flu across their hospital data set, and then determine whether the states that had requirements, whether it was an assessment requirement or offer or ensure, actually had an uptick of vaccination rates or a reduction in influenza cases. And so what are the kinds of conclusions that the study was able to draw? It ended up being that facility level mandates were estimated to increase influenza vaccination among all healthcare personnel by 1.2 percentage points in states with assessment laws, 6.6 percentage points in states with offer laws, and 3.3 percentage point or 3.1 percentage points with ensure laws. This is the kind of conclusions you want to be able to make in a legal epi study. You want to be able to say that the law actually had impact when you control for other variables. But one of the important pieces to this kind of research is that it challenges our assumptions. Was very easy for me to go into the study thinking the states that have an ensure law, that they mandate hospitals to make sure their employees are vaccinated, are going to mean that there are going to be more vaccinations within hospital healthcare workers. And it turns out that having an assessment law and having an offer law were the most impactful based on this research. Now, there are a variety of limitations to this kind of research. For example, because of CMS, because of joint accreditation of hospitals, we have already essentially policies that are forcing hospitals to ensure that their employees are vaccinated for influenza. And so that can be one of the reasons to account from this variation. But it takes a lot of political capital to more now in a post-COVID world to get a state legislature to pass a vaccine mandate as an ensure law is. And isn't it great now that we have data that shows that an offer requirement could be even more impactful and much easier politically to get passed? Another example of a legal epi study is one that the CDC engaged in the early days of the pandemic, as we saw states implementing mask mandates. Were those mask mandates actually reducing COVID in the context of COVID hospitalizations? This is exactly the kind of research that you would want to have available, particularly when you have an emergent health issue with, at the time, limited research. And so again, we had the lawyers for the study. I wasn't part of it. Lawyers on the team look for the mask mandates, and then end up doing a comparison with our epi and statistician and data manager colleagues to figure out what they could conclude about mask mandates. And they ended up concluding that the mask mandates ended up reducing the rates of COVID-related hospitalizations. Now, at this point in our life with COVID, this feels, I think, very obvious, but remember how little information we had in 2020. And remember too that assessments weren't just about mask mandates. What about curfews? Curfews are a really challenging public health intervention with significant constitutional implications when you're limiting what folks are able to do and where they are able to go. And so this legal epidemiology allows us to make some amount of conclusion related to the legal interventions. There are, as I'd already mentioned, limitations to this research. Historically, law and policy has been really difficult to evaluate. There's so many competing variables. Just because there's a law in the books, that doesn't actually mean that a jurisdiction has appropriated funding to facilitate, for example, enforcement. Statutes and regulations or local ordinances or tribal codes are really prime for review on these kinds of studies. But you could have an agency policy that might not be binding, but everyone is going to be treating it like binding, or an attorney general making a statement related to how that they are interpreting a certain provision, or a case law that's also going to talk about interpretation. This kind of research is really time consuming and it's expensive. So I made a livelihood of doing this kind of research for 4 years at the CDC. And I would work on some projects for literally years. The healthcare worker vaccination project I worked on all 4 years during my time there. So it takes a lot of financial resources in terms of having to pay for folks to conduct this kind of research. And the interdisciplinary nature of the study means that you are going to need a really big team to conduct this research effectively. So I want to transition a little bit away from how legal epi has been used so far to what this might mean for Indian country. Everything about legal epidemiology and to this point is should be challenged in the context of how it's going to be applied in Indian country. So we can think about both the considerations for methodology and for methods. So when I'm referring to methods, I'm talking about how is the research actually being conducted, and then methodology underlying the theory framework, the decision-making for conducting the research. Why are certain questions being asked? Why are certain questions not being asked? How is the data going to be gathered? Who is gathering the data? How is it going to be analyzed? How is it going to be shared? How is it going to be interpreted? Both these issues are important considerations when we're talking about conducting any kind of research and including legal epi research in Indian country. I want to go ahead and acknowledge that there has been no resource that has been more helpful to me as an academic working in Indian country, particularly as a non-native academic working in Indian country, than Decolonizing Methodologies, Research in Indigenous People by Dr. Smith. And then my second favorite, Indigenous Statistics, a Quantitative Research Methodology by Professors Walter and Anderson. And so a lot of what I'm going to be sharing with you is applying many of the lessons that I learned from these books. Legal epidemiology has been almost exclusively included research studies to assess state and local laws. Legal epidemiology universally utilizes Western methodology for conducting the research, and it is conducted almost exclusively by non-Indigenous researchers. The biggest funder for legal epidemiology studies is, I would say, I haven't done the data analysis, but this is a vibes, is the federal government. And so it is requested and funded by non-Indigenous actors. And the goal of Legal Epi is to get evidence-based policy changes. And so because of that goal, I want to spend a little bit of time challenging its utility, or the assumption of utility, in terms of Indian country. Dr. Smith says that research is not an innocent or distant academic exercise, but an activity that has something at stake and that occurs in a set of political and social conditions. Another quote from Decolonizing Methodologies that is indelible for me is that researchers will come with goodwill in their front pocket and patents in their back pocket. And while legal epidemiology is not a type of research study that is going to generate patents, it is often going to generate publications. It is going to mean funding and grants. And it is folks like me who have made entire careers as a non-native that has specialization in conducting research related to Indigenous law and policy. How this research is used is remarkably important. Most of the research, I want to backtrack, retract that statement I was about to make about how a lot of Western scientific peer-reviewed studies and research is often going to be presenting pamphlet knowledge. What Dr. Smith says, they don't actually highlight what needs to be done and how that could be used to make effective changes within a community. Doctors Walter and Smith talk about how researchers create statistics, leave marks on them, not just because we are biased in an overt or conscious way, because social, cultural, economic, and political perspectives infuse the research data, even when we think we're just counting people. And when we think of the fact that the goal of legal epidemiology is to change policy, I was struck by what Dr. Smith says about the greater dangers, the creeping policies that intruded in every aspect of our lives, meaning Indigenous peoples, legitimated by research, informed more often by ideology. When we have non-Indigenous actors like the federal government, they have an entire history of forcing tribes to pass certain laws, whether it is with tribal constitutions after the Indian Reorganization Act in the 1930s, where they said, yeah, we're going to give you a lot of funding, and here's the 15 different things that you need to do in terms of your law and policy and governing structure. To more recent, within the last 2 decades, trying to impose policies like certain abortion restrictions in tribal codes. And so I think this is an important reminder for me, especially, that if the goal of legal epidemiology is to create evidence that can inform policy, what are our expectations when translating that into Indian country, when we have modern day colonization often coming in the form of these are the best policies that should be implemented. Some other pieces of information that are really important in terms of the quality of the outcome evaluation research that comes out of legal data is that already with health outcome data, which you all are way more versed in than I am, is very suspect when we're talking about data related to American Indians, Alaska Natives. There are a remarkable variability in terms of how Native people are defined in various survey instruments, under federal laws, under state laws, under tribal membership requirements. Racial misclassification is rampant, especially when we're looking at death certificates that where racial identification is being done by primarily a county medical examiner or coroner. Undersampling, omissions. racism and stereotyping that permeate the collection. On the legal data side, unlike when I'm looking at a state statute or state regulations, I can go to one of 3, 4, 5 different databases and have access to every single state statute in every state and every single state regulation. I could go to any state's website and have access to their statutory and regulatory code. There is no equivalent in the context of tribal law. And that is an exercise of tribal sovereignty. Tribes get to decide if they're going to contract with organizations like LexisNexis or Westlaw to put their codes on these searchable databases. And very few tribes end up doing so, which is perfectly within their purview. And even if a tribal code is included in a database, there's going to be a very good chance that the contract has not been updated to include updates in the code. So you might be dealing with a tribal code that's 10, 15 or more years old. It can be really important when you're trying to assess the changes of law over time and how that has changed health impact. So doing a longitudinal analysis. Even with this at the state level, definitely at the local level, it can be hard, for example, to find historical regulatory data in certain jurisdictions. And so tracking the changes of law is even more time consuming and more expensive. And in the context of assessing what law applies, which is a fundamental problem when we're talking about federal Indian law, is if you're trying to figure out the health outcome of a certain law, are you looking at a federal law? Are you going to look at the tribal law? Are you going to look at the state law? And whether or not a state data privacy law or tribal data privacy law is going to apply to any one person requires a really robust legal analysis of civil jurisdiction that can frankly vary from person to person. And so we don't have, this is federal Indian law at its worst, is that it is so complicated that it makes it much harder to determine who is a certain law is going to apply to, and then be able to say how that law is actually impacting health outcomes. I mentioned towards the end of my presentation, although should really have been presented earlier, sent it earlier, that alongside all of this, we have issues of Indigenous and tribal data sovereignty. Almost always the data sets that we're going to be using, whether it is a health outcome data set or even a legal data set, is going to have ownership by federal, state actors or researchers, and that really runs against the idea of tribal ownership of data. And I've written a little bit, and it's part of an academic piece. We often talk about the right to be counted and the limitations of data access, but there has also been significant and ongoing harms that researchers and academics have conducted in Indian country using their research. And so what does that mean for the right not to be counted, to not have to have your data be implicated, whether it's at a tribal level or an individual level, is something to think about. So all of these reasons why legal epidemiology doesn't necessarily, shouldn't necessarily be plucked over from the state and local government side and plopped into Indian country. But Walter and Anderson make clear, and I want to make clear too, that it's not that because of all these reasons, any kind of legal epidemiology research in Indian country has no value. We have to see more evaluation studies. But what I try to argue in my research and in my trainings is that there are way more considerations that need to be made in terms of methodology and in terms of methods, because the impacts can be really severe in terms of a study that either isn't methodologically well founded. And that brings me back to the abstract, the title of the research piece that I highlighted earlier. So I would say there's a lot of folks in Indian country that want more information on how effective Tribal 638 programs are. And we really welcome this research that was conducted by a PhD student that studies economics. And this student's conclusion is that although the public health 638, although Tribal 638 programs have been really important, there's little evidence on their effect. And so he was conducting a legal epi study because 638 programs are a function of federal law, and the contracts and compacts that tribes enter into are legal documents. And his conclusion, using data from agreements from 1993 to 2018, comparing that to county level death data, mortality rates. And he concluded that these results suggest that self-governed healthcare system led to substantially worse health outcomes for Native Americans. That is a bold statement, and one that completely runs afoul to everything I have heard anecdotally from anyone in Indian country. I have heard nothing but praise for the option for tribes to contract 638 certain health functions. And while none of these facilities are immune from challenges, they have the uptick in the usage of them alone suggests that there is a benefit to tribes and their communities. In reading this study that this PhD graduate, now a professor at a major university, I had significant concerns about the health outcome data they used, concerns about the legal data, lack of consideration of the limitations of his conclusions. For example, could it be that tribes that would on paper have the lowest mortality rates see the need for 638 programs more than others? The fact that 638 programs don't live in a void. They are one location of healthcare that live alongside of IHS facilities. Indigenous people access state care from state providers, both public and private. And it was very clear to me that this study was conducted by a researcher that was not only non-native, but had no experience working in Indian country. And I say this, and I make the bold conclusion that that they should not have been conducting this research. And that if a qualified individual is conducting this important study, that their research would, at a minimum, have been much more nuanced. And what is the potential harm in this? Well, this could easily be plucked as one of the few studies on the efficacy of 638 facilities and then be used to undermine them. So I am concerned that the student was encouraged for years of their education to pursue this study, and that it did not end up including a variety of very important perspectives that would have potentially changed the results, or at least how the results were discussed. And I think this study also frustrates me and reminded me of another quote from Smith's book. Why do they always think that by looking at us, they will find the answers to our problems? Why don't they look at themselves? The idea that tribes are creating harm by 638ing their healthcare is just such a ridiculous premise. So a few slides ago, I had asked about, considering the difference between methodology and methods. Why was this the research question that was asked? Because I could point to hundreds of state and federal laws that lead to morbidity and mortality in Indian country. Why pick this one related to a tribal decision to exercise their governing authority? So I want to end with a few considerations in terms of study design. So again, because my goal is not to say there should be no legal epi studies in Indian country, but how can legal epidemiology be used? Well, you could study changes in federal law over time. You could study changes in state law over time. And then the health outcome can be tied to Indigenous people. You can do comparison of health outcome data across states with different laws. So just plucking literally out of the air right now, I have done a lot of research on state level laws related to consultation and coordination with tribes. Which states have commissions, which states have mandates, which states have tribal liaisons in their offices, consultation policies across their agencies. And it would be great to do a comparison of the states with certain kinds of consultation and coordination requirements to the states that don't. And what does that mean for certain outcomes? We could do a study on changes in local government's law over time. So a single county or a single city, and then track the changes and how those changes have impacted the community's Indigenous populations. And then again, you could do the same thing where comparison health outcome data across different local governments. Mostly because so much of legal epi research is 50 state assessments, sometimes local government assessments. There is this urge to take legal epi and do tribal code research, which may be fine. So you could say changes in a single tribe's law over time and what impact it's had, or potentially comparison of health outcome data across a group of tribes with different laws. And I put asterisks across these last two because those are meddling in tribal laws. And ultimately going to be the goal of that research is going to be making conclusions of regarding what laws a tribe should or shouldn't have. And I think it's not to say that no one should ever conduct that research, but it strikes me that is something that has to have real clear a tribal ask and a tribal request for that research, and a clear delineation of how that research is going to be used, if it's going to be disseminated or not, and in what ways. But for all of these studies, considerations should include who's asking for the research, who's funding it, who's conducting it, how is it going to be done, how is the research going to be used. And this idea of neutrality and objectivity, I know many folks have been challenging it in the context of research, but no research is neutral. This PhD student was looking for a sexy topic to work on that was underutilized and would get a lot of clicks. That is not neutral and objective. And it certainly was not done to support outcomes in Indian country. It was done completely independent of that. And so I'm starting to push away from this idea that my research is objective, because it's not, because I have feelings and opinions, and my goal is to support tribal sovereignty. So I say that going into legal epi and tribal research, it should be done for two reasons: to be of service to tribes, support tribal goals and supporting tribal sovereignty, and for advocacy, changes at the federal, state, and local level. One thing Dr. Smith talks about in her book is that the rapid increase in social science research involving the Maori was directly related to the fact that enforcing treaty obligations necessitated having better data. And if that is not a great example of not just the need of research, but that the goal of the research should be to make changes and to make political changes, because objective, Western-based, neutral research is none of those things, and it's done nothing, or much of it has been a complete disservice to Indian country. So I think that is it for me. I'm happy to take questions now or later in the session. I sadly won't be able to join you all for all 3 hours. I'm going to have to hop off in about an hour and 15 minutes. But my contact information is here, and I'm hoping that I can connect with you all again soon. Thank you.
Thank you so much. We really appreciate that. Does anybody have any questions? Go ahead.
We have a question here. A very basic question. First of all, thank you for the presentation, Dr. Haas. Very, quite an overview. What's the difference? Why are we calling it legal epidemiology and not public health research on the impact of policies?
And just to give a little bit of context on that, Dr. Haas, that's a lot of what our presentation is actually about, is going into the nitty gritty of what the process of legal epidemiology actually looks like, right? So it's funny you bring that up, because technically, and please correct me if I'm wrong, and Monica and I were just talking about this, so it's called so many names. So like public health law research is actually also legal epidemiology, which is also legal mapping. So it's all very interconnected, right? So we're talking about that. One of our slides talks about how like these all are intertwined together and are the same, but there's little slight nuances among the difference of why you perform one as opposed to another.
Great. I'm so glad that folks are going to get that context. Y'all should feel free to call me Isla. I would just also say legal epidemiology, the term is relatively new. I remember very clearly, I was like, a minion at the time, but being in the rooms or near the rooms where folks are like, well, what are we going to call this? Legal epidemiology sounds good. And it is not like no one has been studying the impact of law until the mid 2010s. Social science researchers have been doing it for a really long time. I would say having lawyers trained on the scientific study is a much newer phenomenon. Working alongside epidemiologists, newer. But I will say too, and this is something I've written about and ingrained in all of this, both my opinions and my writing on this, is that I'm biased and I'm a lawyer and I see every, I am a hammer and every hole needs a nail in it. But I've done a lot of work along with a lot of my peers on how there could be risks for folks that have not been properly trained in legal research to conduct that research in a way that is not legally sound. And so some of my work in the past has been challenging some of the conclusions that have been made in really high profile opioid use disorder related studies, where non-legally trained researchers were trying to track, for example, data impact across changes in the law over time, and they were plucking the dates from the wrong spot in the database because they just didn't have training on that. And I have made mistakes. I mean, I make mistakes constantly, and in research and in publications and presentations. So I don't say this to elevate myself and put down any other researchers, but this is why I should not be doing public health research without public health practitioners on my side, right? That I can't understand all the vocabulary. I know this for a fact. I did a big data set on tick-borne disease laws, and I couldn't follow it all. And so this is why interdisciplinary collaborative work is really important. And this is why the work that you all are doing is so great, because there's a tribal support on the work and county support on the work, so that there's going to be less opportunities for any misunderstandings in terms of understanding, interpreting, and the application of the law. But the research itself isn't new. The rigor, the more rigorous methodology, I would say, is definitely in the last 20 years that we've seen a real proliferation of better quality legal research so that we can have better quality evaluation data.
Yeah, I wonder, Monica, if I can make a comment as well on legal epidemiology.
Yes, please.
Thank you. Thank you for this great presentation. I wanted to say, as someone who has been around since the start of the APIS project, that APIS was started because the kind of work that was being done in public health around issues such as this was often being done poorly. And for all the reasons that we've been discussing so far, is that people would sort of use the law as a yes no variable without understanding the nuance and complexity within that, particularly around what we do now is trying to disaggregate data and create a number of variables within a particular policy area so that we understand it in its context, or at least as best as we can. And once APIS started, the Alcohol Policy Information started from NIAAA in NIH, we saw, or that was about 22 years ago, we saw a real uptick in an improvement in legal methodology, because I think one of the things we talked about is people were using at that time a lot of cross-sectional data as longitudinal, as if the laws don't change over time. They were misunderstanding the notion of effective dates, and so applying data to time periods for which the law was not applicable. There was a lot of that. And then what happened, part of what happened in the history of legal epi is that when the Temple Law School Public Health Law Research Program started, Scott Burris and others around him, like Alex Wagner and many others, really worked to start training lawyers and social scientists both on how to do this work properly. Because as was said, the lawyers knew one thing, the social scientists knew another. Neither of them knew what the other needed and how to do it properly. And so that really improved what we're doing over time. And there's been this real uptick in the work. And when people talk about the terminology, whether it's legal epidemiology or public or legal policy research or legal mapping, it really is all the same thing. For example, the public health law research people talk about the epi as the method and legal policy research as the endeavor. So it's not, yes, they are interconnected, but they are kind of also the same thing, if that makes sense. So I just like to leave it there before I talk too long and say, this is sort of the history of what's happened. And I absolutely support the idea that that APIS was started with, is that the only way to do this properly is to include both lawyers and social scientists, and just reinforce that concept. And I guess the very last thing I want to say is, when I first started working with you all, I talked about the idea of legal epi being quantitative, and a lot of what we might do is more a mixed methods kind of study. You can do something quantitatively with the right set of research questions, but to truly understand it, you really may need a lot of qualitative research to go with that. And maybe even looking at laws more holistically rather than as just variables. And so I wanted to bring us back to that notion, because I know as a group, we haven't talked about it in a very long time, that legal epi is only one framework. It's only one lens to use through which to understand what it is you're trying to understand. And alone, it tells you only some things, and they may not be fully contextual and fully understood. And that's it from me. Thanks a lot.
Thank you so much. I believe Iris had a question.
Uh-oh, we can't hear you, Iris.
We can't hear you, Iris.
Your speaker might still be your headphones.
What about now?
Oh, there you go.
Okay.
Yes.
Sorry. Um, so I guess for me, it's more of, first of all, thank you for having this presentation. And it really made me think this whole week, I've been hearing a lot about data and a lot about the 638 contracts within our own Indian health service programs. And, a lot of the things that we really don't pay attention to is the torts law. that is in the 638 program. We don't have medical attorneys that we're aware of. So with that, it's grateful that you were able to do this presentation for us, just to have like a little, for me, it was a little bit more understanding of some of the situations that we may run into on our tribal levels. But going with that, it's just that, just being interested in having all that data in place and having it available, because we have reached out to other agencies that we work with, and we are not able to collect the data that we need, even in our own local areas. So thank you for the presentation. It was very helpful for me on my end. Thank you.
Thank you so much. I got so excited, and I want to stop me if I'm really
No,
pivoting.
go ahead, you're good, you're good.
I'm not a torts attorney, but in my work in federal Indian health policy, torts is a really important piece of this. And I will say I'm really delighted that this is an issue that you've been reflecting on, because my academic lawyer brain, which is I'm not on the ground there alongside y'all, but the Federal Torts Protection Act provides tort a liability protection for tribes under their 638 as part of their contract. But the contract is specifying the program, services, functions, activities that have been 638'd. And so there is the absolute potential, and I really got nervous about this during COVID-19, that the healthcare facility that is in existence because of 638 contract are going to be doing things outside their program, services, and activities functions. And then what does that mean for liability? Because it only extends within what's contracted and exercising activities outside of that. And so this is where tribal law can be so valuable in terms of providing an additional layer of coverage, especially as we're seeing more and more tribes wanting to expand their healthcare offerings even outside of the federal funding, so that they can have more flexibility. For example, because federal funds can't be used to provide abortion care. There has been some discussion, academic and in practice, in terms of how can tribes provide that? Well, they have to use their own non-federal funds to be doing that, and then that's going to be kicking out of the Federal Torts Claims Act. So I'm glad you raised that, and I got excited, so thank you. And there are lots of folks here on this call I know have a lot of experience with data, but it is devastating how difficult it is to get data that we all believe that tribes are legally and morally entitled to. How are you supposed to be able to do any of these studies if you don't have outcome data? The healthcare worker vaccination assessment that I was involved on, that I shared with you, we only did one evaluation legal epi study, and that was on healthcare workers and hospitals. For a healthcare worker hospital's flu vaccine, but we collected data on healthcare vaccination requirements across 6 different diseases. So we did Hep B, we did varicella, we did pneumonia, among others. And we looked at not just hospitals, but we looked at ambulatory care facilities and long-term care facilities. And yet the only data set that was available in all of that data that we collected on the law side was hospitals and influenza vaccine. So in a lot of ways, we have to know what health outcome data we've got available before we can even just have a conversation about what law is going to impact that. Because if it doesn't exist, or if it's not of sound enough quality, there's not going to be more than you can do except for collect the law and say, maybe this has an impact, but not actually conduct the statistical analyses you might want. Anyway, thank you.
Thank you so much. Do we have any other questions? Okay,
I have a question.
Oh, Rebecca has a question.
Geraldine.
And then
has a question.
Geraldine.
Go ahead, Geraldine, you go first.
Very quickly, thank you, Dr. Haas. I just had a question. Are you seeing tribal epicenters beginning to I guess have more of a focus on tribal legal epi? This work, Just curious.
I actually haven't, and that's not to say um that they're not. I just think there's just so much work to be doing just on the data side. And there's already so few attorneys that are well versed in tribal public health law. Um, and I feel like the attorneys that are working with techs are doing a lot of policy work and not necessarily legal epi work. But again, I can't 100% sure. And sometimes my, yeah, I think I'll stop there. So TBD, but I think they're really well situated given the volume of research that they do to be able to be big players in that space because they're already implementing indigenous methodologies in their studies.
Thank you.
Thanks, Carolyn.
And Rebecca?
Oh wait, Iris said something in the chat though. Iris, do you want to talk a little more about what you said in the chat?
Can you hear me?
Yeah.
Okay. Yeah, so also along with that, just learning about the public health uh, um in tribal areas, because just learning that Mr. Anthony Yapa, myself, and Monica Vigil from the tribal areas were part of the thank you, Jalen, different kind of acronyms all week. But anyways, we did a data conveying and we talked a lot. I'm glad the Department of Health was available at this conference, which Dr. Patahon and Janet Johnson were at the table. And we talked a lot about data during the COVID time. You know, me as a contact tracer for my tribe during COVID, we inputted a lot of information. We networked with the Department of Health, but when we came back to where we needed to do the reporting, our main question at the data conveying conference was, when is DOH, when is the county, when is, or even local tribal tribes are going to do a debriefing of all the experience that we had during COVID, and where is all the data going to be going, or who has the most data or quality data in order for us to bring back to our leadership. That's really been the main question for me this week, because we as tribal programs or tribes, we have data that we did collect as part of contact tracing, especially for the pandemic. Where are we going to go? What's the recovery of it? How is it effective? And today, this morning, I'm in another meeting, and I was asked, what are you going to do with the data once you get it? Well, you know what? I said, we could use this data in so many different ways. Sustainability is one, because with now speaking for my tribe, we were able to get some contracts during the COVID pandemic through DOH, and a lot has helped. We were able to get the CCHICA grant, and it's really helped. And just speaking to a lot of different entities this week, it made a big difference on how global warming has really made a big impact during COVID. So I'm grateful for your presentation. I'm grateful for the team, Rebecca and Jerlyn and everybody else on here, that how it's bringing light to some of the tribal areas that have a grant through DOH for the services that we do provide. It's a learning experience for me, and I also have great colleagues that can help me get through these programs. But it's just very interesting how everything is taking into full effect, and how we've learned from the pandemic and how we can go forward with the mitigation and recovery.
Absolutely, Iris. Thank you so much. Does anybody else have, oh, you have your
Yeah,
question?
sure.
Sorry,
I
Rebecca
have
has a
two
question.
questions. And I probably just come down to one, but so as you know, we're doing this kind of as like a climate and health focus, right? So what are some specifically water laws that we can look at that can correlate to health outcome data? So I would love your thoughts on that. And then additionally, I know that a big part of this grant originally through our funders was to try to make legal epidemiology more of a community-based approach as opposed to this very academic approach that you're talking about, right? So ensuring that we're doing this community focused and the policies and the issues that we're looking at are what the community's telling us, right? Of course, we're confined within our funding of what we're expected to do, right? But we can let the direction, the scope be defined by community, and I would love to hear your thoughts on that as well.
I feel like I'm gonna let you down a little bit. Because you all, I boast no particular expertise in terms of a social scientist conducting community-based participatory research. You all know way more about that. But in my work, particularly with legal epi studies, having them be kind of client or community or customer driven, whatever label that you want to have, in terms of the defining terms and explaining the significance, because it could really easily be getting into the weeds of a lot of issues. But I recall, someone a few years ago when I was still at CDC wanting to get some more work done on suicide, and this was a state level data request, and we had to decline it because there was no legal feasible way we could feasibly do the request, and part of it was because it was just so broad, and I ended up having to sit down and show this requester the database, and I was like, look what happens when you type in suicide into this database. It gets tens of thousands of laws. We have to narrow this down to make it a project that is like meaningful and tangible. And so it sometimes means that you're having to be, training folks on research a little more instead of making those decisions. I could have come up with 3 or 4 really narrow topics, but is that really serving the client? And so those communications are incredibly important, and they need to be iterative during multiple steps in the process. And there's nothing like, let me show you exactly what I mean. Because otherwise it's really hard to, I think, understand, what do you mean the database doesn't do that? I think sometimes it's easier to work backwards in terms of the goals. So I hear climate change and water, and I was like, oh my gosh, we could right now drum up in 3 minutes, I think 50 different legal topic areas, right? Are we going to be doing lead? Are we going to be doing point source pollution? Are we going to be talking about particular manufacturers? Are we particular industries? I just had a colleague give a presentation on the intersection of employment law, pregnancy, and climate change. And so what does that mean in terms of employment rights for pregnant people who are going to be disproportionately burdened? And so I think that knowing that you've got this big umbrella, maybe pinpointing, like, is there a law that you already feel like is ripe for change? And that might be another question. All of this is, the science and math, the data access, but is the goal for your communities to actually change part of their code?
Yeah.
And so what's ripe? What is politically ripe for change? Because if you're talking about some water law issues, well, what is much of it is going to be federal law. So we've got this preemption issue already. And like, are you all going to be wanting to make changes in federal law? So you're going to have to identify, these are the 6 areas that the state is really active in. These are the 7 areas that the tribe has very clear jurisdiction in. And so I think kind of figuring out ways to narrow. You cannot narrow enough I say this all the time, it might be that you all have to do cover less than you want to when you're doing this. I think Sue might have a thought too.
Oh, no, I was just, my settings were messing up, but yes, you're absolutely right. We've talked extensively about narrowing. And because our project is in tribal communities as well as some local jurisdictions, we have kind of double issues because locally, a lot of it is state-based, of course, or I shouldn't say locally. In New Mexico, a lot of the law is state-based, but we have that jurisdictional aspect. So I just want to highlight what you said is absolutely true. And it's really hard to do because if you want to study an effect of a law, it's not going to be focused in just like, let's say, water law, one narrow area, because there are going to be so many other things that affect it. So, Rebecca, I was hoping you talk about more specifically what we're meant to do on our project, and what we're funded to do, and how we can broaden that discussion.
Do you mean like in terms of, like our narrowing of our scope?
Well, there's that, but what we're funded to do very specific things. We're not going to carry out, at least not that I've ever understood. I could be wrong about this. We're not going to carry out a legal epidemiology study such as has been discussed here today. We have a little different set of goals with the money that we've been given, and that's what I thought you might elaborate, or Monica, if you'd elaborate on that a bit, that might bring us back down to how we might narrow our discussion as well.
Yeah, I mean, I think, and this kind of, we go into a little bit of legal epidemiology examples are always states, right? You're always comparing states to states, and it always happens that way. And I will tell me if I'm wrong, but it feels like everything you look at is, comparing state to state, but that isn't where our funding is, right? It's to look at the variation across jurisdiction at one point in time. So you were talking about overtime, and I mean, our funding is limited, Sue, as you're saying, but so it's, making sure we do come back to earth on like exactly what we're looking to see. I know that it is in our grant that we would implement policy, but I do think that's something that we need to talk about of what is that actually gonna look like? And realistically, it's not gonna be federal. Could that potentially be state, right? Like longer down the line, but I do think it's important for us to remember, and I know we all talked about this a good amount when we decided to focus in on water, is that this was not gonna be a small task. And that's why, and hearing both Sue and both of you talk about needing to narrow, I hope does everybody feel like I haven't just been telling you these things on repeat?
Well, one thing to add is there are plenty of legal epi studies locally. I've done a bunch of them. But we're looking at 6 communities, and some are tribal, some are city or county. And so we have a particularly interesting legal research task is we're not going across. I work on a project in California that looks at 50 different California cities. So we can, whether it's cross-sectional or longitudinal is not the point here, although sometimes it's both. It's that we can compare city to city to city to city, where we have different jurisdictional foci here. And so that makes our task especially interesting. And I thought that we also might consider that in how we approach the work beyond the policy topic itself and all the kinds of things that fit into water, whether it's groundwater or surface water, whatever. We have a kind of complicated task here, and that's I think part of what holds us up in our discussions.
This sounds like a perfect time for me to pass the baton. Thank you so much for the opportunity to share a little bit about my work and frankly my feelings on this kind of research in the Indian country. And I'm glad I'll be able to join you for a little bit longer to hear some other perspectives on this. Thanks, folks.